JB Buno here with everybody on WFLA Now. Governor DeSantis expected to speak here momentarily here from Jackson Health in Miami. There you see the shot of the doorway. Governor DeSantis, we're being told, is moments away from walking through that door for the press conference that's going to be getting underway here. The first press conference since the national record high for COVID-19 set here in Florida. 15,300 cases reported on Sunday, followed by a near record of 12,624 the following day, that being Monday. Here comes Governor DeSantis, various Miami officials here speaking live. Everybody will listen in on WFLA Now.
Well, good afternoon. I want to thank Carlos Magoya for hosting us again at Jackson, and thanks to Mayor Carlos Jimenez for all the hard work he's done over many, many months, working very closely with us here in the state government. We came to Jackson in, I think, early March, when this pandemic was really starting to pick up steam. At that point, I don't even know if Miami-Dade had a case, a positive test, maybe a couple, but it was obviously much different than what we're finding here. So I think the every day, and you are doing nothing. So I think falsifying information, and you are misleading the public. Over 4,000 people have died, and you are blaming the protesters. You guys have no plan, and you're doing nothing. Shame on you. So at that time, when we had the when we were here, we had a whole bunch of concerns about what would end up happening in the next few weeks and months. We had concerns about testing. We weren't able to even get tests. We weren't even able to get tests for all the people who needed them at the time. In fact, there were probably hundreds of tests being conducted a day statewide, and nationally, just thousands of tests that we'll be doing. So that was a huge concern. How do you get testing going? There was also a big concern about a lack of personal protective equipment for the hospital employees and obviously people who are working in the testing. Treatment was a big issue because, quite frankly, no one knew how to handle this virus. Nobody knew whether there was even any treatments that could work. And of course, we were monitoring the entire time hospital capacity, making sure that our hospital system would be able to handle what the clinical consequences of the virus. So we went into that period with a lot of uncertainties. Florida was able to get through the March and April wave, but we knew that with regards to this virus, that period wasn't the end, or really even the beginning of the end, but really the end of the beginning. And so throughout May and the beginning part of June, we were fortunate to be able to have a very low rate of people testing positive. The cases were low. The hospital census was low, and that was a good trend that was happening. Then as you got into mid-June, you started to see the cases rise. And yes, the testing was rising too, but the percentage of people who were testing positive, instead of being 3, 4, 5% like it had been in May and early June, was now going up to where it ended up hitting even 15% just last week. You also saw an increasing amount of traffic starting in that third week of June for people visiting the emergency department with COVID-like illnesses. Throughout May and early June, it was very low and steady. Same thing with influenza-like illnesses. And of course, we started to see more admissions for coronavirus into our hospital system, particularly here in Miami-Dade County. And I know many Floridians are filled with apprehension as they wonder, what does this mean? What do these trends mean for our health, for our families, and for our jobs? How long is this going to go on for? What's going to happen with things like kids being in school? I hear you, and I, along with our federal partners, our local leaders, and our great medical community, we're working nonstop to be able to respond to this crisis. Now, we have to address the virus, with steady resolve. We can't get swept away in fear. We have to understand what's going on, understand that we do need, that we have a long road ahead, but we also have to understand that within the context of the moment. So a comment on some of the cases, because I think that we hear a lot about a number of cases. And that is true, that somebody has tested positive. That creates a case, the way this stuff is reported. It's also important to understand if you have X number of cases, how many tests were conducted to be able to get to that many tests. So, for example, the last 2 days, people have talked about a record number 2 days ago, and then today, not as many, but still a significant amount. 2 days ago, the state of Florida conducted 144,000 cases. To put that in perspective, when we were here in March, we were probably doing hundreds a day. Then we got up to doing 5,000 to 10,000 a day. The whole United States was probably not doing 144,000 tests at the beginning of March. And so that is an enormous amount of tests. Today's report was 112,000, 113,000 tests. That is a huge, huge number. Fortunately, although the cases were commensurately high with that testing, the percentage of people who were testing positive has finally started to decline. We'll see if that's a trend or whether that'll be something that is short-lived. Certainly, we can say that the percentage of people who come in and test positive has stabilized. Throughout March and April, we would have typically 90 to 92% of everyone who would test would come back negative. As we got into May and the beginning of June, we would typically have 95% of the people who test would come back negative. More recently, it's been about 85% of the people who test come back negative. We'd like to get that back to where 90+% of the people are testing negative. We think that we stabilized. We think we may be going in that direction. It's also the case that, as you've seen more cases, we've also seen a decline in the case fatality rate. So Florida, as of today, was 1.5%. That's a fraction of the national average, which is about 4%. And then in other states, you're looking at states that have had 6, 7, 8%. I think that's partially because the folks here in Florida have really learned a lot about how to treat this. Also, it's to the fact that many of our cases are occurring in people who are low risk, particularly people in their 20s, 30s, and early 40s. Nevertheless, I think that that's something that bears mentioning. So we're in a situation where we're taking action every day to be able to address the issue with the spread of COVID-19. Saturday, we were able to get the therapeutic remdesivir dropped in Florida hospitals across the state. That was a request because even though they were due a shipment, sometimes I think at the end of this week or next week, they wanted to have enough because they were using it. The physicians like it, and with the uptick in people in the hospital was needed. So that was able to drop. We're obviously going to work to make sure that supply is replenished as much as we can going forward. We're also assisting at the state level with places throughout Florida, but particularly in South Florida, with personnel, medical personnel, particularly nurses. Carlos Magoya will talk about, if you look at the number of beds available countywide or statewide, there's a lot of beds available. I think the census statewide, I think there's 13 or 14,000 beds that are available. The key is having the requisite personnel to be able to address not just COVID patients, but also people that come in for things other than COVID. So we've already dedicated 100 personnel that the state had on contract basis to Jackson here in Miami-Dade. We've put 100 on the way into the Tampa Bay area. We have a total of 1,000 that are going to be parceled out, which is with our initial mobilization, but we're also going ahead and mobilizing another 2,000. Now, some of those will be used to support our COVID-only long-term care facilities. Some will be able to go to the traditional long-term care facilities to sub in for staff who may test positive and who can no longer be around the residents. And so personnel is probably the number one thing that I have heard from our hospitals and our medical community. And so we're delivering. We also have a request pending with the federal government, with HHS, for some of their teams to be able to come down and assist the effort. We also are expanding the amount of beds in our COVID-only nursing facilities. Florida, from the very beginning, prohibited discharging COVID-positive patients into a nursing home from a hospital if they were still sick with the virus. We also later, as we went on and saw, required that COVID-positive patients be transferred from a nursing home if they were to happen to test positive there. Now, sometimes that just means they get sent to the hospital. A lot of times they're not necessarily in need of hospitalization. They're medically stable, but they do need to be isolated. So we now have, I think, about 14 facilities, and we seem to be adding some every day under the leadership of Secretary Mary Mayhew. So we're rapidly expanding beds in those facilities, including at the Miami Care Center here in Dade. We're also expanding in Broward and Palm Beach counties. This will provide a safe place where a COVID-positive resident of a long-term care facility can be isolated. If they're in the hospital and they're medically stable, but they're still contagious, they can be discharged safely to these facilities without endangering the other residents in their home long-term care facility. We're also doing, and in the midst of getting the results back, with testing every worker at a long-term care facility, all staff, almost 200,000 staff, on a every other week basis. So every 2 weeks, they're getting swabbed, we're sending it in, and we're getting the results back. So we've got results back for over 100,000 of the staff, and fortunately, the percent positive has been under 3%, and that's probably lower than we anticipated, given the prevalence in the community seems to be higher than 3%. So that is going to be an important way to protect those who are the most vulnerable to COVID-19, our residents in long-term care facilities. They represent about 50% of the COVID-related fatalities here in Florida and in many other states. We're also looking to help fortify lab resources at hospitals. When people come into the hospital, if they have COVID symptoms, it's very important for the hospital to know whether they're positive or not so that they can be treated accordingly. Hospitals are running low on some of the lab chemicals. We're working with the White House to try to get more supply down to the state of Florida for our hospitals. We also understand there's a need for faster results for people who are going through things like the drive-through testing sites. The fact of the matter is that there's a lot of testing going on throughout the state of Florida. You have probably 700,000+ tests a day that are being processed mostly by commercial labs. They are backed up. And so when people go through, a lot of times they're not getting their results back for 7 days. Obviously, we want to improve that. And so what we're going to start doing here in Dade, Broward, and in Orange County is establishing dedicated lanes, particularly for people who are symptomatic, where they can then test, swab, and then go to a lab that can turn it around quicker so that they get their results. So we're going to be working on that, which is very, very important. So we have capacity throughout the health system. Carlos Magoya will talk about that. It's very important for people to understand they plan for these types of eventualities, and they're keeping their overall census very stable, even as COVID has represented an increasing part of the census. We have a special obligation to protect those who are most vulnerable to COVID-19, and we're obviously doing a lot more than any other state, I would say, in terms of protecting our long-term care facilities. We're going to continue to do that. Also, folks who are not in a long-term care facility but are 65 and older are at increased risk. We've advised since March that those folks limit contact outside the home as much as they can, and by all means avoid crowds. I think it's also important to listen and follow the guidance that's put out by local officials such as Mayor Jimenez. And so, here in Miami-Dade County, that means being diligent about wearing the facial covering. That means following the other directives that he and some of the other officials here have put on. It really will make a difference if everyone does their part. At the state, we have also stressed the need to avoid the 3 C's when it comes to social distancing, and that is closed spaces where you're packed in tight, in poor ventilation, that is a good venue for the virus to spread. Also, crowded places, the more people that you have together, the more likely you are to see a spread. And then really close, sustained contact. Most of the infections occur in the home because you have close, sustained contact amongst family members. That's just something to think about, whether you're with friends and family. That is a vector for transmission. So, we have all guns blazing here. We're going to continue to be providing support statewide, but particularly here in South Florida, where we see the epidemic is the most significant. And I just think it's important to note, I was talking to one of the leaders of a hospital system in Central Florida, and he said, we're having much better success discharging patients back home who are healthy at this point, better success than what they had in March and April. And so I think that's a testament to the folks who've been really working hard in the medical system here in the state of Florida. But I think it gives us all hope that we're going to get through this okay. And with that, I want to recognize my friend Mayor Jimenez for his comments.
Thank you, Governor. And if that reporter is really distracting, what you're doing. Thank you. I want to thank you, Governor, for being here and showing and giving us all the support of the state to the people of Miami-Dade County. We know that we're going through a rough time here. We have over 2,000 people now in the hospital with COVID-19. We have over 400 people in ICUs. We have over 200 people in ventilators. These are all record highs for us. As the governor said, everybody's focused in on the number of people that tested positive. That's really not something that we really focus in on, because we know that there's a heck of a lot more people that have COVID-19 that are actually reported officially. We look at the positivity rate. And the positivity rate here in Miami-Dade County now is over 25%. We have taken some measures. We've instituted new rules and regulations. We've instituted a curfew to try to drive down the positivity rate down, so that we can start to reduce the number of people that we have, residents that are in the hospital. We do not want to overload the hospital capacity of Miami-Dade County. The governor has been great in adding additional resources here in Miami-Dade County to our hospitals. He will continue to do that. Also, thank you all for your efforts in bringing the medicines that we need down here and the resources that we need down here. And so, again, very appreciative of that. But the message that I want to give the community is that we have to follow the rules. Please, if you follow the rules, if we all do what we're supposed to do, we can drive the level of contagion down here in Miami-Dade County. Contact tracing is something that we need to have. We need additional contact tracers, but in the end, until we start to drive down the contagion level here in Miami-Dade County, we really can't get a handle on it. And so, again, it's up to us to reduce the level. It's up to us to protect each other. It's up to us to protect the economy, because if we continue to have further rise in the level of contagion and more people going to the hospital, we have to take additional measures that will actually, roll back some of the openings that we had in the past. And so, again, the message is, please follow the rules, maintain social distancing, wash your hands, don't touch your face with your hands, and if we all do that, then we can drive this contagion level down. We can stop the rise in the number of people going to the hospital, and then we can get back to normal much faster. And so, thank you, Governor, for all your efforts. Thank you also, Carlos Migoya, and coordinating our efforts here with all the hospitals. And as the governor said, they are very creative in how to create additional capacity in Miami-Dade. And I'm sure that we're going to have less and less of the elective surgeries being conducted here. As a matter of fact, most of them have stopped. It'll create additional capacity, and so we're not there yet. But again, it's up to us to make sure that we never get there. And so with that, I'm going to turn it back over to Carlos Migoya, who's the President and CEO of Jackson Health Systems.
Thank you, Mayor. And first of all, I want to thank you, Governor, for being here. I also want to thank you for your support. Those 100 nurses came in very handy at the right time, and for the meds and all the support that you're working. I know you're working on the reagents as well for the labs, which something that right now for us is extremely near and dear as we test every patient that walks in the door. We are entering our 5th month of having COVID patients. probably right around now. This is probably about 4 months ago. I think, Governor, you were absolutely right. It's about the time that you got here, and it was around the time that we had our first patients in the door. And that makes it very, very difficult for all our employees, specifically the healthcare workers that are dealing with these patients on a day-to-day basis. The stress that goes with that, it's extremely, extremely difficult. And it works through them to every other employee in the hospital. We have seen a dramatic increase of patients over the last 30 days. About 3-4 weeks ago, we were around 200 patients. Today, we're exceeding 400 patients, of which about 100 of them are in ICUs. The challenge with that is not necessarily the fact that we're running out of, everybody covers the fact that, oh, you have so many patients, you can't get any more. We have been able to manage from the 200 to the 400 number by maintaining our census the same. How have we done that, you might ask, is the fact that we have reduced the number of surgeries that we're doing. And by doing that, we're getting less non-COVID patients in the door. Our census throughout the system, it runs in the mid-1,300 range at this time of the year. And we've been able to maintain that for the last month in spite of the fact that we went from 200 to 400. That means we have a higher percentage of COVID patients today than we did a month ago. That is obviously very stressful to every employee because we have to make sure that we have the PPE and they're on and make sure everybody's covered and protected. So the three things that we work on here every day, which are the extremely, extremely important priorities, are to make sure that we admit only the people that need to be admitted, that we discharge the people once they don't need hospitalization as quickly as possible to make a bed available for the next patient. And last but certainly not least is making sure that all our employees are protected, not only in the hospital, but in the community so that we can keep them working and being able to take the patients as much as we can. We have seen an increase of employees that with symptoms that have a higher percentage of COVID, and it's still, on an overall percentage of our employees, it's not as big an issue, and having those extra nurses have really helped us a lot. But we are managing the numbers. It's not, as the governor said, it's not the number of beds. We have the beds available. It's a staff necessary to do that. And to do that, we got to make sure not only that we have those extra nurses that the state provided us, but also make sure that our employees continue to work and doing the things that are necessary. We have seen, we saw for a while the number of inpatients age becoming younger. And we saw that for a while. Now, the same number of younger patients are being admitted, but because the increase has happened, in that increase we're seeing older people coming back in. That means that the younger people have been contaminating the older people and making it difficult for the older people. So on a percentage basis, the number of people, younger people, is reduced, but the absolute number of people are the same. So those are the challenges we're working today. Every day is a challenge. We're still doing some surgeries, predominantly the emergent, as you would imagine. We have also a lot of patients that need surgery outside of COVID. COVID is not the only disease, unfortunately, that we have in Miami, and many of these people have been deferred for too long and now have become emergent patients. So this is a tough balance that we're dealing with today. We focus every day on our employees, and the employees are focusing on the patients on the best that we could do. But I will tell you that we just came off, the mayor and joined me in our 4 o'clock meeting today with all the hospital CEOs from throughout South Florida, and we're all going through the same balance of balancing our census while we're bringing in more COVID patients. We can do that for a certain period of time. We cannot do that forever. So the message, when you hear the governor or you hear the mayor talk about the fact that we need to be social distant and we need to be wearing masks, that is the absolute answer. It's not whether we open too early or we should shut everything down. The issue right now is enforcement. If we can get everyone to be socially distant and wear a mask, that's the only way that we're going to be able to reduce the number of beds being used in hospitals and be able to deal with with this entire disease and reduce the deaths that are happening in our community. So that's all I have to say, and thank you very much, and I guess we'll leave it up to you, Governor.
Yeah, and I would just stress, after talking with pretty much every hospital that I've spoken to, we saw a decline in people seeking medical care for things like heart and stroke in March, April, because of, I don't know if it was fear of catching coronavirus, maybe fear that there wouldn't be room in the hospitals. And what that's led to, I think, here too, as well, as the patients in the ICU for those conditions are now in worse shape than they would have had they sought the care. So please go and seek the care that you need, particularly for those really serious ailments like heart and stroke. Delaying that is not going to be good for your health. And obviously, while the coronavirus is an important thing, it's certainly not the only issue as it relates to people's health. And certainly when you're talking about heart and stroke, I mean, those are major drivers of poor health outcomes. So please seek the care that you need. I want to thank Carlos Magoya for having us. Thanks, Carlos Jimenez, Mayor, for working hard and really collaborating with the state. And we're here to help. We're going to do more. We're working with the federal government to deploy some additional teams because I do think it's really about people power at this point from the medical perspective. And I know you guys have capacity, but we got to have those good folks here. So, and with that, I'm happy to take some questions.
Governor, I should ask, what's the actual plan? Because you talked about nursing homes, you talked about hospitals and testing, but you kind of didn't mention anything in what you're trying to do.
Well, all those. I mean, the nursing home is probably the #1 thing you can do to reduce the risk of mortality. Because if you look at our mortality statistics for coronavirus, it shoots up once you're 75 and plus. And usually it's because you have one or more comorbidities. And so we're going around testing staff at nursing homes, for example. If a staff tests positive, then those residents may be tested. And fortunately, most of them test negative. But if you have one that tests positive, they need to be isolated at things like our COVID-only nursing facility, because if not, it will spread, and that is the most vulnerable population that it will spread to. So that's a huge way to not only reduce the spread, but to protect those who are the most vulnerable to the spread. Look, I wish if you could just stop it, you could stop it. But there's a huge difference between a 21-year-old and an 85-year-old when it comes to this coronavirus. So that is really, really important in terms of our strategy to protect the most vulnerable and reduce infections amongst those who are most susceptible to negative outcomes. Yes, sir.
The number of tests, as you mentioned, increased by something like 50,000 from Friday to Saturday, and then again, over 100,000 yesterday. What's changed that you have so many more tests now?
It's a couple things. One is just demand. I was going around in May begging people to get tested because the traffic was pretty slow in a lot of our sites. The state, we're operating close to 50 sites, and of course all the hospitals are testing everyone that comes in the door. So you have way more capacity. I mean, we basically have a testing industrial complex now where you can really crank them out. Now the labs aren't quick as turnaround as we'd like, but that's it. And these nursing home tests, while all of them haven't been reported yet, that's going to be 200,000 tests every 2 weeks, just continuing to come in. So I think that's part of it as well. So there's a lot of factors. But when we went into May, we wanted to expand testing because we thought it was important as we went forward, and particularly to prepare for whatever the virus would do after we got through the March and April. And we thought if we could go from 10, 15,000 tests a day to about 30,000 tests a day, man, that would really be doing good. We're now, I think we've probably averaged in the last week, probably close to 100,000 tests a day. So when you're looking at the cases, just understand that we are diagnosing a lot of people who are either completely asymptomatic or who have very minimal symptoms. And so that's a good thing, because then those individuals can be isolated. They know they have it. They may be contagious still. But it doesn't necessarily mean all the people that are going to test are ill. What we're finding is there's a fraction of people that go more for employment reasons. There's another fraction of people who may feel they were exposed to somebody who did test positive. And so we have the ability to do that. But it's much different to look at cases today than it was in, say, March or so. So some of the states that had bigger outbreaks then, they had high cases, but they were doing 20, 25,000 tests a day and getting 10,000 positives. If they were doing 140,000, they would have 60 or 70,000 positives. So it's a little bit different in terms of what's going on here now. We do have a lot of testing capacity, and we have a criteria, which is basically if you want to test, come to one of the sites and do it. There's no symptomatic screen and there's no age screen. So that's just generating cases that are not clinically consequential, but important to know. But I think that We're going to continue to do the long-term care every 2 weeks, so that's going to be enough. And then we'll see what the traffic looks like with this. You know, Miami's been a little different because I think they've had pretty consistent traffic on their test sites, on their ED visits. You know, we've actually had a week decline statewide in COVID-like illness ED visits. We had been basically flat all through May, beginning of June, and then it went up and really crested kind of the last part of June, kind of plateaued for a little bit, and then now it's come down, and so we hope that's now a 6 or 7 day trend statewide. We hope to see that. We are seeing some pretty good indicators, even though, you know, when the Sunday numbers came out, everyone's talking about, oh, the number of cases. I was looking inside that and saw some trends where you see positivity going back down in some pretty key counties throughout Central Florida and other parts of Florida. So we look for those trends as well, and I think some of those trends are positive. I think, you know, our biggest concern is South Florida right now, and that's why we're, you know, we worked hard to get the medicine. We're working hard on and this is just the beginning of the staff support. You know, we're here to do more, as you guys need to do more, because we understand the challenge and we want to be there to help.
Governor, I want to ask you about lab capacity, especially you're talking about an increased number of testing, which of course causes the backlog at the lab. So does the state have the funding to increase staffing at these labs?
They're mostly private labs. So like we have labs, we have 3 state labs, but they do a limited number. I mean, they're doing, I think, about 1,000 a day, which is helpful. That's a 24-hour turnaround. But with the numbers we're looking at, obviously, we had set up to have one of the big Roche machines, just like Carlos tried to get one here. We all wanted to get them this summer, and now they're like, oh, well, you can get a machine in February. Well, we're not going to need it in February. We won't need it as much in February, hopefully. So it's really working with private labs. Now, what we did with the long-term care is we have a company that's kind of a newer company, and it's a self-swab test. You send it directly to them. They're data guys. They run it. They send it back a report every day. That's what we're looking to do, something like that for our symptomatic drive-through test takers. So someone that's exhibiting, you know, legitimate symptoms, we want to know, do you have it or not? And so we can do that and maybe get a quicker turnaround on that subset. The problem with like the lab, all the big labs, is that we went from testing 100,000 a day as a country, and then even as we got into April, May, we were kind of like 400,000. Well, now in the last like 6 weeks, we're now in like over 700,000. I mean, Florida alone, we tested more in one day than some other countries have tested. I mean, Taiwan, I think, has tested less than 100,000 people. So that's just the challenge is that. And I don't know that there's... They have limited capacity. So you have, they're getting backed up. They're getting hundreds of thousands sent every day. And the turnaround time is just not what we would want it to be. We were hoping to be, we wanted 48 hours. That was our agreement with some of these labs. And really by the second week of June, there was no 48 hours. I mean, it was basically at least 5 days. And some of these people are 7 days. The problem with that is if you're asymptomatic and you come back positive on the 7th day, you're probably not going to be isolating. If you don't have symptoms, you're probably going to wait for the result. So if the goal is to stop asymptomatic spread, I think that delay really hurts it. And then I also think you can test negative on day 7, but you could have been infected on day 6. So in some ways, it could be a false sense of security. So we're working on what can we do. I think with the symptomatic, this could be one way. We have the money. I mean, we could pay. If there was a way to pay, we would pay and get it turned around quicker for sure. But I think this is a problem all around the country. Well, look, I mean, obviously, you know, we want to have safe environments across the state. I mean, we've obviously had a lot of, a lot of operations have been going on, government. We've had a lot of private sector businesses and everything, and I think all those have wanted to take, to take the appropriate precautions. I would just note, when you're looking at the schools, I think that, one, a lot of parents want to have the option to send them back, but I also think parents should have the option to not to do virtual if that's what they want to do. I believe in school choice. The science on it, I think, is pretty clear about kids being extremely low risk when it comes to this virus. And not only that, but they are not considered vectors of transmission. And that's been shown in Sweden, in Switzerland. Iceland did a study. I mean, they're all coming out the same way. So I think we just look at that and then go. But I think you can do it safely. And I think that these countries are showing, that it could be done safely. But I do think parents should have the ability to opt for virtual if they want to. Yes, sir. Let me go here. Well, so here's the thing. I'm not going to dictate, how everything goes. I think that you have Miami is looking at a different situation. You're going to have a lot of school districts around the state that are going to just go open up, and that's going to be it because they haven't faced, a similar epidemic that you've seen in places like Miami-Dade County. So I've told the Commissioner of Education, work with these districts collaboratively, understand that we have a very diverse state. That's been my approach to almost all of this stuff, recognizing that the response here is just going to be different than it would be in different parts of the state. And I think that there's other parts of the state, for example, address coronavirus much differently, but it's been effective for their area. And I think the same thing should be true here. I just, my fear on this is the amount of damage that will be done if kids have no options to get back to school. We've put a lot of effort into virtual education in Florida. I think we mitigated the damage better than a lot of states, but I'll tell you, there's a gap that has developed. I think it's disproportionately hurts our low-income students from low-income families. And I don't know what the end point would be if you just say, that they're not going to go back to school. So you got to look at, okay, what are the risks involved? And to kids, it's very low. You can look at the adults and say the risks, but I think those have been managed in other areas of life. But then on the other side, say, what are the risks if they don't have an outlet to be able to do this? And I think those risks are profound, not just in educational achievement that may be lost, but if you look at mental health, if you look at just the social fabric, kids being able to develop, being able to participate in activities like sports, I think is very, very important. So, but at the same time, I think we have to recognize that it's a big, diverse state, and I'm willing to do that. Federal government did it for us, so. So I've talked with Carlos about it. I think pretty much everyone I've talked to has said, look, we can expand within our hospitals. We have the beds. I mean, statewide, we've been between 10 and 15,000 beds consistently empty for the last 3 weeks, even as we've seen traffic come in for coronavirus. So I think if they have the personnel they need, I think they would prefer a standard of care here, and I think you can do that. That was put in really. Part of it was thinking about maybe isolating people who were in multi-generational households. The problem is we're not going to force anyone to do it, but if you did have a situation like that, I know Jared Moskowitz is working with folks down here about, offering hotels, because what we're seeing is you have somebody in a household, and then you have other generations, and guess what? When you're in close contact under that same roof, the chance of it spreading is very, very high. And so the question would be, would someone be willing to isolate at state expense in a hotel for a week or two? And some of them may not. Now, I'm not going to force anyone out of their home, but I think that's an option just to try to stop the spread within a household if you have some vulnerable individuals there.
Will there be a statewide mask ordinance?
You say the state is providing to our area hospitals. Where are where's this medical personnel coming from? Other parts of the state, outside of Florida?
So basically at the beginning of this in March, we took a number of steps to prepare for what could potentially come down the pike. Obviously, there was a lot of uncertainty. So we entered into contracts with companies that provide additional staff support. I mean, these guys work with companies to do this all the time. So it's no different than what a hospital would do. So we have folks under contract. We haven't had to execute the contracts, but after hearing from the folks here in Southern Florida, we felt we should do it. So we executed the 1,000 that we had. Jackson has, they'll have their 100 by the end of this week. I think they have half of them now. We're going to be deploying 1,000 around the state. Some of it will be in
breaking news on WFLA Now. Here's JB Buno.
Hey everybody, JB Buno here with you live on WFLA Now. Not exactly sure what just happened there. We were listening to Governor DeSantis in a Q&A after the press conference had concluded the announcement portion. Oh, I believe that they are getting to a live report there from their reporter at our sister station in Miami. So that was why we lost the back end here of the press conference. We're going to be switching over here to the Florida channel. I believe we will listen in here. Hold on momentarily, everybody. We'll see if we can get you over. And then coming up afterwards, a live discussion on WFLA Now with Daisy Ruth and myself.
And I know they've been working on it for a long time. We've been helping you a long time. We're going to get through it. You guys are a strong city. You're a strong county. And you're really a great engine for the state of Florida. So, it's not necessarily going to be easy, but I'm 100% confident that we're going to get through this in good stead.
Thank you, Governor.
All right, so we missed a little bit of the back end of the press conference there due to losing our signal from our sister station in Miami. That is Governor DeSantis making an exit there at Jackson Health. JB Buno and Daisy Ruth here with you live, everybody, on WFLA Now. Good to have Daisy here with us in the Stream Center. We're going to be breaking down what we've learned today. We're also going to be bringing you the clip of the heckler that interrupted the beginning of Governor DeSantis' press conference. At the beginning of DeSantis' announcement or his remarks here at Jackson Health, there was a masked individual, a masked man in the back towards the reporters that were there to ask questions to the governor, shouting, "Shame on you," and "You're misleading the public," and some other things. You'll be able to hear it yourself in just a moment's time. But let's start here with Daisy with what we've learned here in this press conference. Daisy, no major announcements. Governor DeSantis saying some of the things that we've been hearing over the last several days, last several weeks, even in light of a national record of COVID-19 cases in a single day reported on Sunday with more than 15,000 cases in just that one day alone.
Right, absolutely. Governor DeSantis has been pretty steadfast in this, saying the enormous amounts of tests we are doing. Yesterday's update, Sunday, from Saturday, over 150,000 tests came back with that. But again, that's not 150,000 people that were tested just then. Sometimes those test results are indeed a little backed up. And both Governor DeSantis and Mayor Jimenez said that we're really looking at that percent positivity, which here in the state right now is 11.51%. I can tell you, JB, that the percent positivity across the state that has been trending down for the past 4 days. So while we are seeing this record number of cases, that percent positivity is going down. One thing he did note was that remdesivir dropped in Florida hospitals. He had mentioned that was coming. I believe he said it was maybe Sunday or today that was distributed throughout Florida's hospital, that remdesivir, the coronavirus drug that is best issued when someone kind of first becomes infected with the disease.
And it was an interesting comment, too, that I want to add on here from Jackson Health President and CEO Carlos Magoya. He said that this isn't about opening too early or too late, that Magoya referencing many of the online comments, many of the commenters on WFLA Now saying that Governor DeSantis or wanting to opine that Governor DeSantis had opened up the state of Florida too early and was too aggressive with that phase-based approach, going from phase 1 to full phase 1 to phase 2 and reopening the state too early. Magoya saying it's not about opening up too early, it's not about closing too late, that this is about getting the word out, enforcing social distancing, and letting people know that we have to do everything that we can from a societal perspective to curve the trend in the right direction. And that's what Governor DeSantis, Mayor Jimenez, and Carlos Magoya were talking about here in this press conference. Daisy Ruth, JB Buno here with you live, everybody, on WFLA Now. We've been running a WFLA Now interactive poll. We have more than 3,500 votes in our interactive poll. We asked you, with Florida setting the national single-day COVID-19 record, what should Governor DeSantis do? Either reclose certain businesses, as in, maybe we're talking about changing our phase-based approach to closing certain businesses and enacting similar rules as what we saw with the bar rule of not allowing on-site consumption of alcohol. That was several weeks ago. Whether or not you want to see a statewide mask mandate, that was an option that we gave you too. And then we also gave you the option of both or neither. We're going to be getting into that poll result here momentarily. But what I really want to do for you now, everybody, is get to the comments here. This was from Governor DeSantis a short time ago, or this is the press conference a short time ago, the very, very beginning. So bear with me here. What I'm going to do is see if I can bring this up here, full screen, everybody. And this is the clip from the beginning of the press conference when the heckler interrupted Governor DeSantis' announcement. Listen in.
Different than what we're finding here. So I think the
every day, and you are doing nothing.
So I think
falsifying information, and you are misleading the public. Over 4,000 people have died, and you are blaming the protesters. You guys have no plan, and you're doing nothing. Shame on you.
So at that time, when we had the when we were here, we had a whole bunch of concerns about what would end up happening in the next few weeks and months. We had concerns about testing. We weren't able to even get tests. We weren't even able to get tests for all the people who needed them. Different than what we're finding here. So I think the
every day, and you are doing nothing.
So I think
falsifying information, and you are misleading the public. Over 4,000 people have died, and you are blaming the protesters. You guys have no plan, and you're doing nothing. Shame on you.
So at that time, when we had the when we were here, we had a whole bunch of concerns about what would end up happening in the next few weeks and months. We had concerns about testing. We weren't able to even get tests.
So there you have it. That was the heckler there, everybody. At the beginning, the very, very beginning of Governor DeSantis' press conference, we were eager to learn if there was going to be any significant announcements made or what Governor DeSantis had to say, again, after a record-setting day here, not just in Florida, but for the entire United States. There isn't a single state that has reported even 13,000 cases, let alone 15,000 that we had. That was the figure on Sunday. So very eager to hear what Governor DeSantis had to say. And then out of nowhere, usually these press conferences are very much closed off and just reserved to, to the people that are supposed to be speaking and to members of the media and any technical crews such as cameramen, photographers, so on and so forth. Very surprised, Daisy, that we had a heckler there at the press conference. We haven't really heard of too many incidents like this one. We've had some people show up to certain press conferences in more public places such as testing sites with signs. We've seen that at previous press conferences, but to actually have somebody vocally shouting in Governor DeSantis' direction is something that we really haven't seen on this sort of scale yet. And I was trying to listen, we played it back that second time because I was trying to listen in to a little bit more of what exactly the heckler was saying. But I kept a
little bit of a quote here from our digital producer, Rob.
Yeah, it was shame on you. You misled the public, over 4,000 people dead. And then at the back end, I heard something to the effect of shame on both of you. And I think that was pointing also at the mayor of the city of Miami. But yeah, what do you have?
Rob's quote here, he says, "You are misleading the public. You are blaming the protesters," which I can say I did not hear. You guys have no plan and you are doing nothing. Shame on you. A lot of shame on you being thrown around.
Yeah, those are the words that were being uttered time and time again. So that was the incident that occurred at the beginning of this press conference. And then again, as we got on and on and on here in the press conference, it was a lot of similar language, a lot of similar verbiage of what we've heard in previous press conferences from Governor DeSantis, such as avoiding the 3 C's, crowded places, crowded spaces, and close sustained contact. That is something that we've heard time and time again. Governor DeSantis I would imagine, has heard the calls for like a statewide mask mandate, or whether or not there's going to be a scaling back of the phase-based approach. And as of right now, nothing like that is being publicly considered. If not, we don't even know if it's being privately considered. Right. But that's what we have. And we're going to get to our poll results here momentarily. Also reading through some of your comments here as well, Daisy.
Yes, absolutely. I did want to mention one thing, JB, that I thought was really interesting, but even though it's not going on here in the Tampa Bay area, as we wait for some #HeyJB, #HeyDaisy comments to come in. I see some for you. But Governor DeSantis mentioned dedicated lanes for those who are symptomatic and for those who are not symptomatic. He wants labs to be able to turn these symptomatic tests around quicker, but that's of course not yet happening here in the Tampa Bay area, though it very well could at some of these larger testing sites like Ray J and the Trop, but that's just happening in Broward, Orange, and Dade. I thought that was something very interesting to mention, because if you see some of those lines, I drive past that Raymond James Stadium line often. It's quite something.
Yeah, and listen, we've said it here time and time again. The testing numbers in Florida are astronomical. I mean, when he said that we're averaging around 100,000 cases a day, six-figure case total or testing totals per day. That's astronomical. I mean, considering where we were several months ago when tests were hard to come by, now we're doing, let's say, 100,000. We're getting 100,000 test results back a day. I mean, my goodness, what a difference several months makes. And yes, testing is becoming more and more available, but the percent positivity is, of course, what people are really honing in on, as they should be, because that points to exactly what percentage of the public is being tested positively for coronavirus for the first time. And that's the numbers that we try to bring you the very most on WFLA.com. Let's get to some of the hashtag HeyJB, hashtag HeyDaisy comments. We want to read through some of your comments. How this works, everybody, on WFLA Now. If you've been with us here before, you know how this works, but we'll explain it to the first timers here that are joining us this Monday evening, July 13th, 2020. Daisy Ruth, JB Buno. So you see the hashtags on the left and right side of the screen. They're underneath each of our names on the yellow stripes. It says hashtag HeyJB, hashtag HeyDaisy. If you would like for us to read your comment aloud, just use one of those hashtags, and then we'll pluck them out of the comment section here. We'll read them, and we'll maybe talk about them a little bit, or maybe we'll try to answer your question if you have a question in the Facebook Live comment section. If you just want to converse back and forth with your fellow commenters here on Facebook Live, just feel free to not use the hashtag, and we won't read your comment aloud. So we're only going to be reading the comments with the hashtag. And let's start here with Patty Stevens Clark, a WFLA top Facebook fan. Hi there to you, Patty. Thanks for spending part of your Monday evening with us. Hashtag HeyJB. He keeps saying the same thing, but is doing nothing to be proactive to slow the pandemic. He refuses to say what he plans on doing. That's the hashtag HeyJB comment from Patty Clark.
Top fan Veronica Rotundo Foley, hashtag Daisy. The school board is having a live meeting tomorrow at 10 a.m. for the public to make comments after their workshop. People can tune in anytime they want. Veronica, what school board are you meeting? I'm sure we have that in our planner, but I have not been able to see that.
And I really want to make this very clear, because it was very, very important that Governor DeSantis saying that parents should have the option for virtual schooling, that this is a very emphatic thing that he has said, that parents should be able to have the option of sending their kids to school virtually. And we're going to hopefully see virtual schooling options presented for not just Tampa Bay area students, but students across the state of Florida, really students across the country, as school starts to, the 2020-2021 school year starts to get underway in the weeks ahead. August, everybody, my goodness, is about 3 or so weeks away. Cynthia Lynn, hashtag HeyJB, hashtag HeyDaisy. Do you remember when DeSantis said opening and closing of Florida will be based on the numbers? So why does it seem like he's going back on that?
It seems like he's now moving towards that percent positivity, which I will say has been on a downward trend for 4 days. I hear a lot about people saying, why are you just reporting the cases and all of these cases? But yeah, we have really been trying to give you that percent positivity, which I believe right now today is 11.51.
11.51%. And we have seen, as Daisy noted, just a slight downtick in that number. I think that if that number had been increasing over the last days with these thousands, tens of thousands of cases coming in per day, I think that Governor DeSantis' tone would likely be quite different in today's press conference, because that's the one thing you can really point to as being not an encouraging sign. You never want to say that it's an encouraging sign, but it's a sign that that leads to at least a shred of optimism, and that's the percent positivity on the decline, at least ever so slightly, over the course of the last week. Cliff McAfee Jr., hey there to you, Cliff. Hashtag HeyDaisy, hashtag HeyJB. He should do both the mask mandate and he should close certain businesses. Cliff, of course, referencing our WFLA Now interactive poll where we asked you, with Florida setting the national single-day COVID-19 record, what should Governor DeSantis do? We gave you several different options there that Cliff noted, and we're going to be getting to the poll results here in just a couple minutes' time.
And speaking of poll results, JB, we ran one after Governor DeSantis spoke on Saturday, and we had 65% of about 3,100 people say that they don't believe Governor DeSantis is doing enough here in the Tampa Bay area. Yeah, and Governor DeSantis was the target of our most recent poll about
several hours prior to this one, saying that he is just not doing, and basically what people were saying was that he deserves the most responsibility as far as the recent COVID-19 spike in the state of Florida. We gave people different options. Listen, is it really us as Floridians? Is it our fault for not social distancing enough and not wearing masks enough and not, staying indoors more and not going out to public spaces more, so on and so forth? And people just wanted to, the most popular option in that poll was Governor DeSantis not doing enough and deserving most of the responsibility. So that was earlier today. I think it was about 1,000 people voting for Governor DeSantis in that most recent poll. Let's see here. Vicky D. Leon, #KJB, #KDZ. Why do you think why do people think asymptomatic cases should not be positive cases? Do they know they are carriers that spread the virus? Vicky brings up a really good point here, because when Governor DeSantis was talking specifically about schools, he was talking about how it's an extremely low rate for showing for showing symptoms if you're a child, if you're a young student, and that I think the exact wording was that the vector for transmission, which basically means that the chances of a child spreading it to, let's say, a teacher or an administrator are low based on international studies, not really studies that he was referencing studies that had been done in Sweden and some other countries. And that is something that we've discussed here on WFLA Now, but I think when parents look at it, parents always want to take the safer rather than sorry approach, which is exactly why having the option for virtual schooling is an encouraging thing to hear from Governor DeSantis for sure.
I have a comment here from, I'm not sure if this is somebody who works as a teacher or a staff member, but Sandra Fairman Ellis, top fan, #KDaisy, #KJB. Why is it that we shut down in March, but now we seem not to care? Teachers and students are soon to be the sacrificial lambs of Florida, and DeSantis doesn't seem to care. Strong comment, wording there from Sandra.
Let's see here. Leslie C. Martin, who shared this stream. Thanks, Leslie, for sharing the stream. Really appreciate it. #KJB. Most tourists are not wearing masks here, and quite a few locals as well. Yeah, I was going to read that comment. I was going to say, listen, I see a lot of people that are just not wearing masks. I don't really think you could just point to tourists and say that it's just tourism that is contributing to this. I think it's a combination of just everybody, really everybody who is who's not wearing a mask. That it's across age, many different age demographics. Though I think that probably in younger people I see it more and more, but it's not just tourists. We can say that pretty confidently. It's us here. It's us local Floridians as well that are just not doing our part. Angelica Perilla, it's either Perea or Perilla, #KJB. Governor DeSantis is being extremely irresponsible. We need to shut down the state. The numbers are incredibly high. Our kids should not be in school.
April Walk-in Horse, #KDaisy school opening should be pushed back to after Labor Day so we have a better view of the state in regards to case activity and positivity. That's something we've talked about before, JB. Since we're not native Floridians, we're always going to school a little bit later. So the fact that kids here in Florida are going a little bit earlier than what we have experienced is definitely something that is very interesting. But I've heard a lot of comments, seen a lot of comments here on our streams about pushing back the start date until Labor Day, which at this point does not seem like it's going to happen.
Right, and maybe a more interesting poll to be running on schooling in the future is going to be: would you rather see school just be, let's say, delayed, the start of the school year be delayed 6 weeks, or would you rather there be a statewide mandate for virtual learning? The virtual learning thing, let's actually talk about this really quickly, because I want to get to our poll results and I want to get to more of our comments. But the virtual learning thing, of course, having that option for parents it's a great alternative if you don't want to send your kids to school given the circumstances. But if there's having the virtual option versus the non-virtual option creates a lot of complications. It's not just like a blanket and end-all be-all solution to all the problems that we're experiencing with continuing education in Florida and of course COVID-19 hopefully being on the backswing by the latter half of this year, there's a lot of problems that come with the option of virtual learning. And while everything has to be done with public health and public safety in mind, just remember, everybody, that education is extremely important. And there are some people that believe that they would that it would be better to delay the start of the school year rather than just have the option for virtual learning. That if you push it back to, let's say mid-September, that will be better. Most schools in most states across the country, they don't start in August. Where I went to school as a kid, you didn't really start until the second or third week of September. And the school year carried through till June. Could there be a delayed school year? Could that be an option on the table? As far as everything that we've heard, the school year is going to start on time, and that it's more likely that we're going to see a virtual learning option in certain districts and certain counties. But there's a loud cry out there for people to just say, hey, listen, we are not in a state right now where we can confidently start the school year, start classes on campuses across the state of Florida with everything that's going on right now with all of these positive results. So it's a very, very divisive issue, and it's one that we're going to be exploring, of course, in future streams as well. Yeah, like Crystal Early, #HeyDaisy, #HeyJB. Virtual learning failed my kids.
Oh.
They need to be in school. With a big exclamation point there from Crystal. And yeah, virtual learning is not, listen, for some kids, some students, some younger students will really grasp it and really take off with virtual learning. And then some students really just need to be in a classroom and really need to have a teacher, 20 feet in front of them to really be able to learn and to grasp the curriculum. It's one of those things that virtual learning is, of course, everyone's begging for it, but it's not just the end-all be-all solution that we're looking for here, everybody. Just remember that. Yeah, Craig Vollmer, #HeyJB. Virtual classes aren't that great. Public schools are, well, all right, your comment. Public schools are cheap, lots of freezing, and harder to learn. Craig, hold on. Craig, public schools aren't necessarily cheap. There's just public schools have a certain amount of funding. And so when you say that they're cheap, it's not necessarily that they just refuse to spend money on more advanced learning systems or more advanced virtual learning software. It's not like that. They just don't have as much funding as, let's say, a private school. Kids aren't paying to go to that school in the same way. I mean, of course, your taxpayer money pays for public school, but it's not the same amount of funding as, let's say, a private school. So when you're talking about yes, there's the public school systems have more challenges with virtual learning than private schools do, but back to the first part of his comment, virtual classes aren't that great for some students, and that's really true.
Kind of switching gears a little bit
Yeah,
here,
let's do
JB. David Faisal, #HeyJB, #HeyDaisy. What is the deal with the governor in New York fines for Florida going to New York? I'm not sure if that was something that came out after your last stream to address this, but yes, it's not just Florida, and you're not going to get fined if you travel to New York. According to Governor Cuomo, you must, I'm not sure the process with this, but detail your travel plans. And if your travel plans and your contact information aren't given to the proper authorities, then you will receive a $2,000 fine. You're not going to get fined if you are traveling from Florida to New York. They're not going to fine you right off the bat. You will have to quarantine. I believe that's up to 60 days now. And your travel plans will have to be brought forth to authorities.
And there's certainly an interesting dynamic occurring with Governor DeSantis being the first one to ban travel from some other states, particularly the tri-state area of New York, New Jersey, and Connecticut several months ago when they were in the thick of the battle with COVID-19 in those three states. And now things are starting to flip around with Governor Cuomo, Governor DeSantis. There's definitely there's some intriguing sub-plot lines going on there between those two governors. Let's just say that for sure. Let's get to our interactive poll results, and then we'll read a couple more comments after that. I see some other commenters talking a lot about school, and schooling is such a major topic. But I really want to get to our poll results because I've pushed this off for far too long, as I normally do. And it's not just because I want the more poll results that we get, the more confident we are in those results, right? Even though they're unscientific, these poll results are still telling, and they still help us get an understanding of how folks in Tampa Bay and how folks in really across the state of Florida are feeling about a particular issue. And really the issue at hand is COVID-19 and the rising COVID-19 numbers that we've had here across the Sunshine State over the last 2 months, or really last 6 weeks, but the calendar months of June and July. So let's get to our poll question. We asked you, with Florida setting the national single-day COVID-19 record, what should Governor DeSantis do? Now, we gave you 2 options. We gave you reclose certain businesses, and then statewide mask mandate, which of course so many people have been calling for the statewide mask mandate now for many weeks. And then we also give you the third option of both. So you want both of those things, the statewide mask mandate and reclose certain businesses, or neither, that you don't want either of them. You just want Governor DeSantis to continue basically doing what he's doing and not issuing the statewide mask mandate, not reclosing services, just basically holding in place here in phase 2. And that's really what Governor DeSantis is doing, Daisy. He's just really maintaining himself right now in phase 2 as we start to see, of course, the number of cases spike considerably here over these last several weeks. So by far the most popular option, we got more than 5,000 poll results, which is a ton. By far the most popular option was both. People want to see both the statewide mask mandate and reclose certain businesses. 60% of our poll respondents want to see both of those things enacted by Governor DeSantis. Behind that was the statewide mask mandate, or excuse me, no, neither was the second most popular. They're very close, but neither was the second most popular option with 17%, followed by 15% with the statewide mask mandate, and just 9% with reclosing certain businesses, which is interesting to me.
Very interesting.
Because that last part, because it shows that people are more in favor of a statewide mask mandate than they are of reclosing certain businesses. That they think that a mask mandate will be a more effective solution in helping us, curve the trend in the right direction. So there you have it, our WFLA Now interactive poll results. Last call for questions and comments here on WFLA Now before we wrap up. Daisy Ruth, JB Buno here with you in our Stream Center, again after Governor DeSantis spoke in Miami.
Still seeing a lot of school comments. Alana Jagger, hashtag KJB, hashtag Hey Daisy. If schools do reopen, will there be daily screenings for the students? We haven't heard of any information about that yet as schools reopen, whether
there are mask mandates.
Mask mandates, yes.
For which counties again? I believe it was
Hillsborough and
Pinellas. And Pinellas, right.
Yes.
And we'll see exactly which counties follow suit in the days ahead.
Whether there will be testing. I'm not sure if a county could tell every student to go get tested at this point before they came to school, if that's what you mean by screenings, daily screenings, maybe like a temperature check. That's something that could very well be enacted. We've seen it at different theme parks and stuff with those, I believe maybe the TSA with the touchless scanners, thermometer scanners. If that's what you mean by daily screenings, Alana, that makes a little bit more sense than daily testing.
Jamie Otero, hashtag KJB, with the order the schools have to be physically open in Florida at least 5 days a week. It's going to be a hardship on staff that are high risk to start. Jamie, if you're high risk, my goodness, if you're high risk, do you want to be going back to school? I really think that for those individuals that are high risk, and high risk could be, a certain health condition that you might have, or high risk could be just the age demographic that you're in. I think you really have to consider your options if you're high risk, right? Because literally your life is at stake. Absolutely. If you're going back to school, and we don't say that as a means as a way for panic or fear or anything like that, but really, like you have to really just consider the risk, and you have to consider what your district and what your county is going to be doing to help keep you safe. Because if you're high risk and you're putting yourself in a moderate or even high risk environment, that's a recipe that could compromise your health and your livelihood. So there's a lot to consider there for high-risk individuals within our school system here in the state of Florida, for sure.
Comment here from William Gurr, hashtag HeyJB, hashtag HeyDaisy. Florida's too big and diverse for one-size-fits-all mandates. Leave it to the counties, which is really what Governor DeSantis has been doing. In the beginning, we were very different, in a very different situation than Miami-Dade County. Now, I could say we are a little bit similar towards Miami-Dade, though not at that extent. And then if you consider Miami-Dade to the Panhandle, or even Hillsborough County to Hardee County. So the comment here, I already lost it. I apologize. But yes, Florida.
William Gurr.
William Gurr saying Florida is too diverse for a one-size-fits-all mandate.
Chase Law, hashtag HeyJB, hashtag HeyDaisy. What happens when a teacher tests positive? Who would teach the class? You know, Chase, I think that's an inevitability that has to be embraced by Florida educators and by Florida administrators, education administrators across the state, that it's just a matter of time before a teacher tests positive. And then what are the subsequent actions that happen after that? I think who will go on to teach the class is probably the least of their concern. That's probably way down the totem pole of the questions, the important questions that they have to ask. The immediate questions are, if a teacher tests positive, okay, then the immediate question is, who has that teacher had contact with? Not just students, but other teachers in the break room, or other teachers just walking in the hallway, or just in other areas where they would be sharing a space. So, and then it becomes, okay, what students were in close contact with that teacher? So many questions have to be asked. I'm sure a substitute, just like if a teacher had surgery for some other medical condition and they have to be out for 6 weeks. Yeah, you substitute teacher. You bring in a substitute teacher, and that would and the substitute teacher would teach that class. But if a teacher tests positive, and it's going to happen, make no mistake about it, it's just a matter of time. And there's going to be multiple teachers that test positive, and then there's a lot of difficult questions that have to be asked afterwards as far as the response and how effective the school district's response is going to be to that teacher testing positive. Will they have to shut down school for a day or several days? Will they have to have? I could see a certain scenario, Daisy. I could see a certain scenario where maybe schools are considering having a plot A and a plot B for school. For example, and this is a contingency that WFLA had enacted, having plot A, all teachers in classes in that one set of classrooms, right?
Yes.
So let's say there's a dozen classrooms in plot A, right? And then plot B has a dozen classrooms that are completely empty and completely disinfected. Could you alternate between those plots to have an alternative location for learning to continue? But that would mean that school districts would have to have that ample space. And space is going to be a challenge if you're going to want social distancing guidelines to be followed at all times, and students are going to have to be spaced out. There's so many challenges that have to be considered. But yes, it's just a matter of time before a teacher tests positive, and that is going to happen. And parents are going to, that's going to be a difficult phone call or a text message for them to get.
We've also heard in different press conferences and different documents that we get, and different ideas that people have thrown around, officials and even our commenters alike, of having students stay in one classroom throughout the entire day. That's something that's going to be interesting with middle school and high school students who usually do move around for different class periods or different class blocks, whatever your child has it called in their school. Will they just be sitting in one classroom for the entire day?
I can't help but think that outdoor classes are going to become. Listen, it's hot in Florida.
It's very hot.
Scorching hot. But when we look at and we listen to some of the medical experts about how this is more likely to be transmitted indoors in closed spaces rather than outdoors, could there be a certain environment for students to learn outdoors more? There are some classes that exist outdoors. It's just not as common here in Florida because it's scorching hot here in Florida. But maybe that's another peculiar sort of outside the box line of thinking that maybe administrators in our education system are thinking about. If there's a way for some classes to be, let's say that you space out students in classrooms, right? And then you need more space obviously for students. Could outdoor classes be an alternative option on at least on certain days. It's not the best idea I've ever had on this stream. Believe me, I come up with ideas every now and again with ideas. It's not the best one I've ever had, but hey, I'm sure that everything is on the table when it comes to our kids and our teachers and keeping everybody safe in August.
Comment from WFLA top fan Charlene Mortillo, #JB. She says, excuse her speech to text, but your comment's fine. My daughter has an autoimmune issue. They don't have enough subs. We have everything we can to try to go back, but I would prefer she teaches from home. So that's the thing. If you are a student who is immunocompromised, has an issue that you shouldn't go back to school, your parents choose you not to go back to school to do virtual learning, you really don't have that option if you're a teacher, and brick and mortar schools are required to be open in the state of Florida. That's where things get a little tricky, a little difficult. That's what you do for a living. But if you are immunocompromised, have an autoimmune issue, and teaching from home, I'm not sure how that's going to be an option unless you are one of those teachers who teaches the students who opted for virtual learning. It's going to be, the way school is going to look this school year is going to be so different from county to county.
And that's why it's so important, and we say this all the time, for you to stay really honed in on what is being announced with your child's district or county or district, whatever. Just making sure that you know exactly what they're doing from a safety protocol standpoint as we get closer to the start of school. It's really important for you to follow their Facebook page, their Twitter page, and to stay really in touch with what they're considering, announcing, any meetings that they're going to be having, virtual meetings, so that if you want to voice your concerns, you absolutely can. Everybody, JB Buno, Daisy Ruth, we got to get going. We really appreciate you being here with us live on WFLA Now. More to come on WFLA.com and the WFLA app. Thanks for being with us. We'll be back.